Hi. I'm here. Right. I went live a few minutes ago and then I ended it because I wasn't quite sure that I got the settings right. Anyway, I'm back. So, hello. And as the title of my video now tells you, today I want to talk about World Mental Health Day and healing. Right. World Mental Health Day is important because we all know that our mental health and well-being is important. Anyone who has listened to me enough knows that actually your mental and physical health and well-being are kind of, you know, that old saying, a sane mind in a sound body. If your body isn't working as well as it should do, then your mind isn't going to do as well as it should do, and vice versa. And your mind has huge effects on your body. I mean, the talk about the mind-body interface, this is something that the ancient healing modalities like Ayurveda and traditional Chinese medicine have known about forever. And it's something that Western medicine is now accepting. So we know that stress can be a factor to make a number of illnesses worse. Anybody who, like me, has got a chronic pain issue, because I've got pain in my hip, will know that on good days you cope with the pain fine, but if something happens to kind of unbalance you mentally, that makes your hip hurt worse. But also, the more your hip hurts, the worse you feel. So while I am delighted that these days the stigma attached to having a mental health problem is much, much less, there's still an awfully long way to go. Now, I had a request to talk about healing. Well, in a way, every single video that I do is about healing. Because in the end, and you may have heard me say this before, I make no apology for saying it again. In the end, if you have a health problem, physical or mental, you are the only person that can take the steps necessary to provide a certain amount of healing. Now, what this doesn't mean is that, you know, with the power of your mind, you can cure all your problems. It's not like that. And I think it's worth talking here, and this is a discussion that I've had before with various people about the difference about what health and what good health actually is. Because the one thing good health is not is a total absence of illness. Because if good health relied on the total absence of illness, then there is absolutely nobody that I know who is healthy. I have a lot of good friends who have cerebral palsy. Sadly, there is no cure for cerebral palsy, but that doesn't mean they cannot have as good a mental and physical health as is possible within those parameters. You may have been born with a congenital heart defect or some other genetic disease. Nothing you can do to alter your genes. So you will always have that illness, but that doesn't stop you from taking steps to be as healthy as you possibly can be. Some people are born with mental health issues that have a genetic component, because although a lot of the work I do with mental health is at the end where it's caused by your thoughts, there is no doubt that there are some mental health problems that can't be cured or relieved by the power of the mind, where just as in cerebral palsy or arthritis or diabetes, some form of medication is necessary to deal with the issues. I mean, how many people do you know who've got ADHD, who need medication to help them function properly? People with schizophrenia need medication to help them function properly, or as well as possible. But that doesn't mean that they can never be healthy, because health is in a way defined by you. You know better than anybody what health problems you have and the restrictions that those health problems place on you. But that doesn't mean that your life has to be defined by those problems. You know, last Friday was World Cerebral Palsy Day, and with fortunate timing, I was actually at the day centre where I run my sessions for them, and one of the citizens said, "Can we have a new mantra today? Can we have a mantra that I embrace my CP?" And it resonated with every single one of them. I could see that, and it resonated with me, because who you are right at this moment is the total sum of everything that's happened in your life, all the good things and all the bad things and all the health issues that you have. So I wouldn't be who I am if I hadn't had some bad life experiences that meant that I suffered quite badly with depression. And if I hadn't had that depression, I would never have discovered all these techniques that can help, that I'm now trying to teach to other people. So am I in perfect health? Hell no. Long way from it, sadly. But I am healthy enough to live what to me is a very good life, and I feel so blessed. But it hasn't been easy to get here, and it's happened because I have made the choices that enabled me to improve my health within the limits of what my illnesses mean for me. And that's a choice everybody has. And that choice is what kickstarts your healing. It can be as simple as realizing that if you don't change your diet, that you're going to continue to maybe be borderline diabetic, and so you choose to make a healthy choice, to make healthy diet choices, so that you can make your body a little bit healthier. If you suffer badly with mental health issues, you have a similar choice. You can choose to reject medication, or your health choice can be, well, I don't particularly like taking medication, but I know it helps me. And that is your choice for good health. Why do I mention that? Because obviously a lot of my techniques, well, all my techniques, do not involve medication. And I know from personal experience, and science has shown that certainly with the most common of mental health problems, which is mild to moderate depression and things like stress and anxiety, medication can have a place, but certainly in the case of mild to moderate depression, it's been shown that talking therapies and CBT are just as effective as medication. And I think the difference is that when you choose to go down the route of CBT or whatever, you are getting actively involved in your own health. And it's only when you are actively involved in your own health that the true healing can start. Because if you define yourself by the fact, oh, I need to take this medication, you're always going to have an unhealthy mindset, whether it's a medication for a physical or a mental issue. But if you see taking your medication as being something that you actively do to improve things for yourself, then you have a health mindset. And that's, in my opinion, when the healing begins. Now, I wasn't too sure exactly how this was going to pan out today, but I know that the issue of choices is very important because that cropped up for me earlier. I've realised I'm faced with choices and I'm the only one that can make them. And I've got to make the choices that are for my best health and well-being. And a shout out to all the carers out there who often feel conflicted because, their own needs come so low. If you don't look after your own health and well-being, nobody else can. And self-care is never selfish. So I'd like to end today with a short meditation. So if you're going to join in, get yourself settled and comfortable. If you are going to watch this video back later to do the meditation, then if you want to fast forward through all the talking, just look for me making my Namaste sign, because that will indicate that I'm really getting into the meditation. So I invite you, if you're joining in with this meditation, to get yourself seated and comfortable. And as you get yourself seated and comfortable, can you explore what the idea of comfortable means for you? And maybe you're sitting in a really comfy armchair like I am. And maybe that armchair gives you a sense of safety and security. So that's something else that I invite you to explore. What sense of security and safety do you have right here, right now? Now, you may find it helpful to take 2 or 3 deep breaths just to settle yourself in, and feel free to close your eyes if that helps you meditate, but you don't have to. And then I'd like to invite you just to gently scan through the whole of your body, starting at your toes and slowly working up all the way to the top of your head. A little bit like a barcode reader, scanning the different parts of your body. So gently pay attention to each part of your body in turn. And as you pay attention to each part of your body, I would like you to notice anything that there is to be noticed there. So start with your toes And maybe can you be aware of the gaps between the toes? And then move into the soles of your feet. All the way back to your heel. And then focus on the top and the side of your feet. And then move your attention onto your ankles. And then up through your shins and calves to your knees. And then from your knees all the way up to your up through your thighs, into your buttocks and your hips. And then scan up your back to your shoulders. And then scan up your front. Into your lap and up through your waist and your abdomen and your chest. And then move your attention to your arms and hands. Your fingers and the gaps between your fingers. Your wrists, your forearm, your elbow, your upper arm. And then give some attention to your shoulders. And then gently let your attention move up through your neck, through your face, all the way up to the top of your head. Now, if there was any part of your body that was sending loud signals, whatever sort of signal it was, I'd like you to pay special attention to that area now. Maybe imagine that you breathe in, down into that area. And if it's painful or uncomfortable, maybe imagine your breath massaging that bit of you from the inside. If necessary, just shift your position. Meditation doesn't have to be static. Shift your position slightly to make sure that you're not putting pressure on somewhere that hurts. Or maybe just take a moment just to consciously relax all your muscles and release the tension. And then I'd like you to move your attention into your mind. And can you notice what thoughts are coming into your mind? Now, if there's a lot going on in your mind, you may have thoughts going all over the place. And even if you haven't got a lot going on, you'll probably find that all sorts of random thoughts come in. But I'd like you to notice something. The chances are that those thoughts that come in either relate to the past or to the future. What I'd like to invite you to do now is to bring your focus into your breath. And keep your focus on your breath, allowing your awareness of your breath to anchor you into this time that you have given yourself. Because just as you can choose how you sit and what you do with your body, you can choose what you do with your mind. You can choose to chew over that argument you had with your friend, or you can choose to worry about what may happen, when you go for that interview in the future. Or you can choose to recognise that they aren't here now, and you can choose to focus your awareness on this time that you've chosen to give yourself. And just for a moment, you can be still and not really do anything. Because it's in stillness that both our minds and our bodies can heal. And you can help that healing process by choosing to give your mind and the body the rest they need. So what I'd like you to do now is to focus your attention on that natural rhythm of your breathing, but noticing all the movement. And as you notice the movement, I invite you to notice that when the in-breath becomes an out-breath, just for a moment, all the movement stops, and everything is still. And then the same thing when the out-breath becomes an in-breath. Can you allow your mind to focus on that moment of stillness? And notice how you feel in that moment of stillness. Can you allow that stillness to be reflected in your body and in your mind? Now, I'm not going to pretend that this sort of meditation is a magic wand that can cure all illnesses. It's not. But what this sort of meditation does do is give you a tool to make good choices with how you use your mind. And on World Mental Health Day, that's a very appropriate message to learn, which is you choose what you do with your mind just as much as you choose what you do with your body. But it's harder to control the mind. Sometimes your mind seems to have a mind of its own, and it rushes around at 100 miles an hour, moving from this to that, not giving you any rest. And if times are like that, then I invite you once more to let your attention rest in that stillness in between each breath. And let that stillness be like the stillness at the eye of a storm. As you rest in the stillness, all those thoughts can race around. But you don't have to follow them. You can let them go. Just as the wind and rain in a hurricane don't come into the centre, but you know they're there. So you can know those thoughts, those feelings, those emotions are there. But in the stillness, they can just circulate round you, not affecting you, and you can give yourself a tiny, tiny bit of a break. So on World Mental Health Day, this meditation is an invitation to recognise that you can have better mental health than you have now by making the right choices. So I invite you once more to focus on your breathing. And as you breathe, can you become aware that there's a body that's breathing? Become aware of your body, where your body is, noting where your body is in the chair, and then becoming aware of the room and the wider world around you, and then bring yourself back to normal awareness. But as you do, keep in the front of your mind the thought that any time you need to still your body, you can sit down, lie down. Same thing is true. Anytime you need to still your mind, you can choose. Just to take our focus in just for a moment to this breath and this moment, and find the stillness in your breath. And just for a moment, let all the thoughts and emotions just circulate around you, and you can come back to them later when you feel better able to cope with them. Okay, that's the end of what I want to say today. If you've got any ideas for what you want me to cover next Tuesday, do DM me. Also, if anything I've said has, piqued your curiosity and think I'd like to know more about that, I'm very happy to do one-to-one video sessions via Facebook or Zoom or whatever platform you're happy with, although I prefer it not to be Teams, but, I can use Teams if I have to. If you would like a one-to-one video session, I'm very happy to arrange half a 30-minute video sessions via whatever video program, video conferencing thing you are happiest with. And I'm not making a standard charge. All I ask is a donation of whatever you can afford, a minimum donation of £1 UK, and it can be at a time that works for you. So please DM me if that's something you'd like to explore. In the meantime, on World Mental Health Day, I hope that you have ways to make yourself as happy and as healthy as is possible within the limits of your general physical and mental health. Remember, you matter, and look after yourself. Namaste.